Another important thing about this session is that we'll be meeting with Saira Ahmad, who is a corporate communication specialist, a very known person in Lahore and in Pakistan, doing amazing work, impacting lives. And this time she has surprised us all. She has volunteered herself for the vaccine trials that are happening in Pakistan for COVID-19, and Saira is with us. So let's have Saira in the session. Assalamu alaikum, Saira. How are you?
Walaikum assalam ji. Thank you so much for inviting me, and it was such a sweet and nice introduction. I was not expecting this after being a volunteer for the trial that I will be interviewed like this somewhere.
No, this is I think a lot of courage you need to have to volunteer yourself for such a trial, because you don't know about how the virus is going to react. This vaccine is in a trial state. You don't know how this your body will react to this vaccine. So this is a very good step. I would like to know, Saira, what made you decide to go for this, or volunteer for this vaccination? What was in your mind, and why? How it was possible? How your brain accepted that you will be offering yourself for the trial session?
I can imagine from where you are coming, but honestly, the first time, I've been following the news all the time, jo bhi TV pe aa raha hai and all that, and through social media, and I knew that trials have been started and all. One of my friend, we used to work together in Lums. Her husband works at Shaukat Khanum. So one day she just shared a brochure on WhatsApp, which had the volunteering information that if you're interested, you can volunteer with Shaukat Khanum. And I saw that, and I just sent her a message that what are the side effects? And she was like, I really don't know, but I will check with my husband and let you know. And kuch din baad, she came back and she was like, these are the basic symptoms and the rest we don't know. So it's all under trials. So when I go, okay, I'm just thinking to do that. And then I just forgot about it. It was like a month or so back when she sent that brochure. Then I forwarded that brochure to my husband. And he saw that and he was like, let's go for this. And I was like,
right?
Are you
Seriously?
sure? Wow. Yeah. So he has also got vaccinated for the trials. So,
okay, great. It's a couple. Wow.
Yeah.
Volunteering as a couple. Right. Great.
Yes. So he was the motivation behind it, because he was like, let's do this. Although I asked him that we don't know yet what are the side effects, and we just know the basic symptoms, and we don't even know when the original vaccine will come. And then I was not very much familiar about the concept of placebo and trial vaccines. So my bhabhi told me that I told her that I am going for this trial, and she mentioned that please do check, you might get the placebo. And I was like, what is that? And then she told me कि placebo में और vaccine में क्या फर्क होता है, and you are divided in two groups, and you might get the vaccine, and it is a possibility that you get the placebo. मैंने कहा ओ, तो मैंने कहा फिर फायदा क्या हुआ? अगर मुझे placebo लगता है तो मुझे क्या फायदा? But then we thought that let's go for it, and someone has to go for it and has to become part of the trials. One of my husband's friend also volunteered. They told us that he and his wife, both of them got vaccinated, and they were kind of a motivation for us as well. If they are going, we can also go. So that's how it all happened.
Okay, so you had the family support as well, especially from your husband, and he is also one of the volunteers.
Just from him. Apart from that, everyone, my mother, my brother, my in-laws, no one was interested that we should go for this.
Okay, I can imagine that. So placebo is basically a control system. We call it control, through which you actually check the people who act the trial, who actually get the vaccine. So why you were kind of depressed or something? Like something like that. you should have got the vaccine. Did they tell you was that placebo or actually you were vaccinated against that virus?
They don't tell you because, in fact, the doctor says that they don't even know if they are injecting the vaccine or the placebo because the coding has been done from China, and only the Chinese researchers and the doctors who have sent the vaccines, they have the back-end coding. So the doctors who are vaccinating over here, they also don't have that information with them. So the only way, one of the ways probably is that if you get the symptoms, then probably there is more chances that you have been vaccinated. And if you are not getting any symptoms, like my husband did not get any symptoms, he had nothing. कोई बुखार नहीं, कोई body pain नहीं, कुछ भी नहीं. And he was quite upset that, oh, मुझे तो कोई symptoms ही नहीं, मुझे तो पानी लगा दिया.
No, because you see this, another reason we don't tell about whether it's a placebo or the real vaccine, because there is a psychological impact as well on the patient.
Yes. Yes.
Because
yes.
if they need to check what is the psychological impact. Sometimes it's a placebo, but you get,
yes.
Psychologically you feel like you are getting the symptoms. So they actually want to study both things as well.
Yes.
So did you get any symptoms or any side effects because of that vaccine?
Yes, I was fine. I got vaccinated at around 12 p.m. in the afternoon, and till 11 p.m. at night, I was doing fine. There were no symptoms. After 12 o'clock at night, I started feeling lethargic, and I was having body pain. I was feverish. I was feeling cold and hot at the same time. My hands and feet were warm, quite warm, but my body temperature was at 93.3 because I checked my temperature. It was at 93. And I had watery eyes, and it was quite tough. Like, I had a lot of fatigue in my body as well. Plus, I have pain in the shoulder where I got vaccinated. I still have that pain. It's still there. So all these symptoms were there for around 2.5 hours. And then I took 2 Panadols at night. And later on, in 1.5 hours, I started feeling better. So that happened. Then on the same day, Subha, I was fine. Then at 2 p.m. on the next afternoon, I started feeling same. I was feeling feverish. I was feeling body pain. Then I again took 2 Panadols, and in 1 hour, I was fine. So after that, I am okay. I just have a little bit of body pain now, but nothing more than that.
Okay. Yes, it's possible. After the vaccination, you can get fever because, of course, your body is reacting to that foreign body in your body. So you do get that inflammation or the fever. So it's very common. Does not mean that you have COVID-19. So what did they tell you about if you get any symptoms, what you should do? Were you supposed to inform them of the symptoms that you are getting? Is there any recorded, do they record it?
Okay, so they do make a medical report of yours before registering, before taking you for the vaccination. So there is a whole process which you go through. So they made a whole file of me with previous medical history of mine. And they even recorded the time at which they injected the vaccine, the exact time in the file. And they gave me the MR code. And before vaccinating, they give you a whole brief of the trial, which is happening all over the world. And this vaccinated with, which is the Chinese vaccine, CanSinoBio. They mentioned that the trials are going on in 6 countries, and there are around 40,000 people who are being vaccinated with this vaccine. And what can be the possible symptoms, which were the basics which I had 2 nights back. And they said that if you feel any sort of fever or body pain, you can take the basic medication, which is Panadol, and nothing else. But still, if you feel that the symptoms are not going away and you are feeling that they are more than the normal fever, or it is more than the normal pain in the body, then you can contact, the Shaukat Khanum. So they said you can contact Shaukat Khanum and you can come into the emergency, or we can also connect you with any specialized doctor if it is required. Plus, they also mentioned that for 1 year, my treatment related to corona will be free at Shaukat Khanum. if I go into any kind of medical treatment related to corona.
Okay, so you had to sign a contract, right? If there is
Hmm.
anything happens, God forbid. So it's you who's, I mean, they are
Yes.
not responsible because you're part of the
Oh
program.
yes.
They
Yes.
take your
When they
consent and
are
your signature.
exactly, when they register you as one of the trial volunteer, they get a, a paper signed by you. There are certain clauses in it which includes that you are going for this trial on your own will and you have not been forced by anyone, including the hospital or any family member or anything like that. And you will be part of certain activities which they will be doing, which includes uh, giving out blood whenever they require. Like they took some blood at the time of vaccination. Before vaccinating, they took around 25 ml of blood, and they even took a consent from me that if I'm interested to allow them to use that blood for any other future trials or researches, for which I said, आपने ले लिया है तो अब आप और जगह भी इस्तेमाल कर ले. It really doesn't matter, but they do take that consent and then you
Yeah.
sign the contract that you have agreed to that on your own will. So वो आप sign करके देते हैं, and any consequences they are not responsible for that.
Okay. Okay. So what happened is that for vaccination, for any vaccine, there are different processes. Whether there is a live virus, we call it attenuation because the virus loses, because of that attenuation or the process, the virus loses its virulence. That means it's infection causing property, but the virus is there, it's live. So the vaccine that you got, did the doctor tell you, was that the live attenuated virus or it's not live? Or it's gone through a
No,
process? Did they mention?
they did not mention anything like that. Nothing.
Okay, so you don't know whether the actual virus, the live virus, is in your body or not. But it's just
Yeah.
just to ease your tension here is that so none of the vaccine that's being studied or under development in the world for COVID-19 has live virus. So I just
Okay.
wanted to clarify this. Okay, okay. So Saira, okay, you said you were very courageous. You went for this volunteering for this COVID-19 vaccine. Uh, do you think and would you recommend other people to join you? And because seeing you healthy right in front of us and talking and enjoying life and super confident about it, it would actually motivate other people to volunteer for this vaccine trial. What would you say
Hmm.
to other
Hmm.
people, to healthy people who you think should go for the should volunteer themselves for this vaccine trial?
Yeah, I think just like I mentioned that I volunteered because one of our known friends went for it, and that was a big motivation for us to go for it because someone I knew was going through it, and he and she, both of them were perfectly fine. And we don't know the long-term consequences. Obviously, in the short run, they are fine. And in the short run, in last 2 days, I am also doing perfectly fine. I'm living a normal life. When I was doing some research about volunteering and all, I did see some of the articles which were published online, and some of the hospitals mentioned that they are facing difficulties in getting the volunteers because people are very reluctant to become part of this trial because this is something which no one knows what will happen. Like even my mother was like yesterday, she called me and she was like scolding me that no one knows what is happening with this disease, and you just went on and got vaccinated. You don't even know what you got inside your body. So everyone is fearful because of that. But I think especially the ones who are healthy, some of us should go and become part of this, if not everyone, because eventually the same vaccine or some better variation of this vaccine is going to come, and we all will be getting all the same vaccine. A lot of people said to me, why did you go for the Chinese one? ऑक्सफोर्ड की आती तो तुम वो लगा लेती. मैंने कहा जब ऑक्सफोर्ड की बारी आएगी तब देखेंगे. For now, I don't think so. Okay, we will be having any other option except the Chinese vaccine because of several reasons at the international level and the economical differences of a lot of countries. So this vaccine is also kind of a competition between different countries. The first world countries and the third world countries will have different kind of discriminations going on, just like any other thing happens in the world. So most probably every one of us in Pakistan, at least this is what I feel. I don't know at a larger scale what will happen, but I think sooner or later, Pakistanis will be getting the Chinese vaccine and not the any other ones, the American or the European ones. But I would like people to come forward and become part of this because as healthy human beings and being the nationals of Pakistan, we do have some responsibility towards our nation. We are not going through that stage where हमने पाकिस्तान को आज़ाद कराना है and we can say to our children that oh we became part of the partition. We cannot say that. we are not in that stage. I am not a doctor. I cannot call myself a frontline warrior. I am not part of army, but at least I can feel
Now you are. Now you
in
are.
the world. So I can at least say proudly that I became part of something which was important for the world, which was important for the country. And if it goes well, I will be happy to be part of this.
Saira, we are so proud of you. It's not easy. It's seriously not easy to volunteer yourself for something which is uncertain, unpredictable, and you don't know actually what will happen. So this is very courageous of you that you decided to volunteer yourself for the humanity and for our country as well. Uh, I would like to, the last question that I would like to ask is that was there a need to inform your work, your boss, or your work that you will be getting tested for this vaccine? Was that mandatory from your work, or what did you decide about it? Did you inform them?
Uh, Honestly, I did not even think about it, that I need to inform at my office. I was like, just I went for it. And when I was coming back from there, I just shared a message in the official group of my company where I was working. And I just told them that I just got vaccinated. And apparently, everyone was excited and was very happy to know that. And even my boss said that, oh, I would like to get vaccinated as well. So that was a response from him. And but I did not inform them before going for this.
Okay. So, God forbid, if you develop the symptoms of COVID-19, would you still regret getting this vaccine? Or you would still be very happy and confident that you decided to be a part of the study that is actually going to benefit the whole humanity?
No, I will be happy to be part of this, even if I uh, get corona or COVID. Because when you go for this, it is told that you might get infected because you are not sure if the vaccine is there or if even if the vaccine is there in your body, whether it is working properly or not. So we have to follow all the SOPs, even if we are vaccinated. So still have to wear mask. I still have to use sanitizer. I still have to do social distancing because there is a possibility that I might get infected. So even if I do, at least I put in an effort and I became part of it. And rest is what Allah decides.
Thank you so much, Saira, for sharing your experience with us. Thank you so much for being part of this study group. Uh, you have volunteered yourself for the vaccine trials against COVID-19, and this is something we should be very proud of that you are part of it. And if anyone would like to get any information, if you want to be a part of this trial, we will get you in touch with Saira, or Saira, it's available. You were vaccinated in Shaukat Khanum, right?
Yes, I was vaccinated in Shaukat Khanum and my husband was vaccinated at University of Health Sciences.
Okay, and you are based in Lahore?
I'm based in Lahore, yes.
Okay, great. Once again, Saira, thank you so much. And we might be calling you again and to see how is everything going. Okay?
Sure, Sure,
Thank
definitely.
you.
I will stay in touch and keep everyone updated so everyone stay motivated that nothing is happening and
Yes,
I am living a good life.
inshallah. Yes,
Thank you
yes,
so much
that's
for
the spirit.
inviting me.
That's the
Yeah.
spirit. Thank you so much, Saira.
Thank you.
Thank
Thank
you,
you.
and
Allah
best of
Hafiz.
luck.
Thank you. Allah Hafiz.
Allah Hafiz. So this was all about the COVID-19, the second wave, and we met with Saira as well, who has volunteered herself for the vaccine trial for COVID-19, and this is very courageous of her and her husband. This is actually they are actually the couple who have volunteered, and this kind of support, if you get from home, if you are for something that is for the whole, for the benefit of the whole humanity, it's hats off to her and her husband. It's not easy because uh, why? Because everyone is scared of COVID-19 and everyone wants to protect himself or herself against this virus. So uh, putting yourself at the front and having that virus inside intentionally and with the consent, it's something very courageous. So we will be in touch with Saira to see how this vaccination trial is progressing. And if you want any information related to COVID-19, if you want to stay updated and want to get the right, authentic, and correct information, then visit the WHO website, then visit the CDC website, and you can also visit NIH website in Pakistan, where you will get the right information. So stay home, stay safe, और इंशाल्लाह हम सब मिलकर जो है वो COVID-19 को eradicate करेंगे. So with everyone's help, support, with everyone's contribution, we can win this war against COVID-19. अपना बहुत ख्याल रखिएगा. Thank you so much for being with us. Allah Hafiz.